Sometimes it feels like the sun will never rise, like the birds will never sing again. Believe in a power greater than what you are going through. When you don't know what to do, keep breathing.
That's right. When you don't know what to do, just keep on breathing. From beautiful Huntington Beach, California, on the healthylife.net radio network, heard in all 50 states and 135 countries, all positive talk radio all the time. From the City of Angels in Los Angeles and from the Big Apple in New York City. Welcome to all my listeners out there in Radio Land. I'm Dave, the Caregiver's Caregiver at caregiverdave.com, along with my lovely co-host. I'm Spit, she's Polish, Adrian Gruberg of the caregiverspace.org. And we're also coming to you live and on demand on 24/7, numerous syndicated radio and podcast networks on 26 global audio video platforms like iHeartRadio, iTunes, YouTube, Spreaker, SoundCloud, Vimeo. The list goes on and on. In fact, we are proud to be voted #1 caregiver podcast of the top 50 on Player FM, #2 caregiver podcast on FeedSpot out of the top 60, and #2 on Caring Village. We have an especially exciting show for you today. I'm going to enunciate all my words properly. Don't we, Adrian?
Yes, we do.
It's hard to do it when you talk too fast. Tom Alexander, CMO and CEO of Radius Care, is a thought leader in the health tech industry. Tom's personal experience as a family care advocate for his mother while battling his guilt for unintentionally overburdening his father inspired him to join Radius Care's mission. Now, Tom has committed himself to spreading awareness about the resources available to seniors and their loved ones, as well as the need for value-based care in the nation's healthcare system. I'm anxious to hear about that because I've never heard of this. I don't know if you have, Adrian. Guess not. But before we get started, I do want to take this.
I'm muting myself because.
No problemo. Thank you for muting yourself. I do want to take this moment to thank my last week's guest, Susan Bratton, Sexual Soulmates, the 6 Essentials to Connected Sex. Exciting, hot show. Reminder, you can watch or listen to that interview and all our interviews on our membership website, caregiverdave.com, or any of our other 26 global networks that I mentioned earlier. Okay, enough of that. Tom, welcome to the Caregiver Dave show, and we're so excited to have you on. And sorry that that's a tough act for you to follow last time.
Yeah, I was going to say, I think you're setting me up here, but it's a pleasure to be here. We are an early stage company. We do wear many hats, but I do not wear the CEO hat. I'm head of marketing and partner engagement, but a wonderful guy named Justin Huddy is our CEO, and he's the visionary of the product and the idea, and he came from it from a personal experience too. But I'm happy to talk about how I found my way to Radius Care and to you and your listening audience today.
Well, I always like to ask my audience the first question: How is it that you managed to? No, let me ask you a different question. Just who is Tom Alexander,
Sure.
and how did he do what he's doing? I mean, what's your purpose in life?
Yeah. So I've held a couple of different roles in my time. I don't. How much time do we have?
45 minutes.
What really drives me is innovations, especially in the technology that can capture people's imagination and give them useful information and tools to move their life forward in a meaningful way. And so I was actually not, I didn't grow up in the healthcare arena at all. I was in television, and then I jumped over to doing startups in IT, technology. So I've lived a few different lives on the business realm, but it is true. My mother suffered from Alzheimer's, and I think I'm a pretty common situation where I lived in the Philadelphia area. I have 2 wonderful brothers who lived in, at the time, the Chicago area. And then my father was taking care of my mother in Ohio. And so we used video conferencing quite a bit with my mother. It was really, I don't know how you feel about this, but it was really comforting just to see her and be with her, even over video,
Sure.
oddly enough. But the thing you referenced in the guilt part of what you bring up is, like every child, we wanted the best for my mom, right? But we didn't have the information. So the thing that that you're referencing is, so what would I do when I would connect with my dad, right? What were my conversations? He spends, and God bless him, he's now 87. In his 80s, he made sure, come hell or high water, my mom is going to stay at home the whole time.
Wow.
But
Even when it hurt him, right?
He's the different kind of person. He saw it as it inspired him to help her. Like, he just was so inspired, and she was amazing too, all the way through. Never had any, sometimes folks that suffer from that can lash out. He was lucky in that she never did that, but again, still an enormous undertaking. But the thing that was that I look back on it, and I'm sorry, is that lots of my time with him was asking about mom. Like, what are you doing? Have you thought about that? Where is she now? What are the doctors? Who are the doctors? And he's living this day in and day out, right? Yeah. So I kind of tucked into my back of my head, like, gosh, I wish there was a better way. That my brothers. So then I have two brothers who are making the same call. It's like Groundhog's Day every day for my dad with us, right? Saying the same thing every day. We're trying to do the best we can from a distance, but he's like the source of information. And that's what I felt most sorry about, because, he needed us for him too, And so, and he never complained once, Really? He never complained once about it. Yeah, I have very extraordinary parents on both sides, but that's what kind of tucked in the back of my head. And then a little later, I came across Radius Care.
So this happens a lot where kids and parents do role reversals. Adrienne does group chats, and she has a group for almost everything. Is one of your groups where you're dealing with your parents and they talk about the role reversal, Adrienne?
Oh, yeah. And we also have a mother-daughter group. We have a parental care group. But what you were saying, Tom, about your dad, it happens too often that no one asks how the caregiver is doing.
Yeah.
And supports the caregiver in that way.
That's right.
They always ask. I used to get stopped on the street by friends, how's Steve doing? No one ever asked me how I was doing.
Yeah.
Guilty as charged.
Well, it's not a matter of guilt. It's really just a matter of experience.
And it's hard for both of them. I mean, but the parents typically act like they're being treated like children, and they resent that and they push back on that. And the kids start resenting that they've got to be a parent. They don't want to be a parent. They just want to be a kid, a normal person. So you've got a negative. How did you handle that? I assume that's what was going through your head, right?
Yeah, I mean, we did the best we could, from afar. As you know, there just aren't that many resources available, unfortunately, for the caregiver. So, we pay to have cleaning services come in, and there are so many amazing local organizations. There's a woman that started an organization. She would hire, a lot of retired school teachers and folks to do kind of, daily care, those sorts of things. We hired them to come in. So we did the best we could, but I feel like if we had more of her health information, we could be more helpful in the way of appointments or specialists, or if we knew exactly where she was in her, in her journey, I think we would have been able to be even more proactive about it.
It occurs to me that telemedicine should also be not just the patient and the doctor, but the caregiver and the physician should be able to have a telehealth appointment so that you can ask those questions. Never thought about that before.
Yeah, my aunt has dementia. My mother died from it, and my mother-in-law died from it. And we do telephone video calls, and I just assume I'm going to be there because they're not going to get anywhere talking to her. Let's talk about collaborating with family members of, for the care of a senior. How different is it caring for a parent than caring for, a stranger if you were in a facility where someone's paying you to do your job? Or how different is it from an unpaid caregiver when they're dealing with maybe an aunt or an uncle or a cousin? Is there some special dynamic dealing with a senior or a family member or a parent that the others don't have to deal with?
Yeah. Well, I'll tell you, what most of my perspective comes from is Radius Care, the product I'm working on. So when I came into Radius Care, I did have that perspective as a child advocate. I was never the direct caregiver for my mother, but the thing I knew is that there is a massive need for this for caregivers. So the first thing I did literally was I dove into the entire world of caregiving. And when you learn that there's 48 million unpaid caregivers for adults, and you learn that, they spend on average 10 hours a week and it drains all this money. And, you very quickly start to see, wow, this is a massive issue that we need to address. So my learnings were more from, we have some great advisors. We do surveys with Medicare members and caregivers to understand where they're coming from. So through that information, you had said that there's a lot of resistance to parents. We did a survey through a great organization called Daily Caring. It's a blog newsletter that goes out. We did a survey through them, and I think it was something like a third of the folks responded that they got resistance from their own parents in trying.
Surprise.
Yeah, and there's a lot of and there can be some, weirdness, in caring for that role reversal. It can be an awkward thing. So I'm sure with an aunt or an uncle, that's accentuated even further, right?
Yeah.
It's a little bit of an awkwardness.
It depends on the personality. Everyone has that crazy uncle that they keep in the closet, and they're usually the ones who come down with something and they don't know what to do with it. But tell us about Radius Care. How did it start? Did you start it? Did somebody else start it? Did you come on? Yeah. And what exactly does it do? I'm a little fuzzy about that.
Right. So it was started by a gentleman named Justin Huddy, and he had a situation with his mother in the healthcare system where he was trying to find information and really recommendations on best providers for her particular illness. And like many of us, first thing he was doing was going online and scouring the internet, which we all, I think, understand that's not always the most credible of information. Mm-hmm. And so he had a vision, and this was probably about 7 years ago when he started it. Things have evolved since then. That why can't the patients, the Medicare members, and their caregivers access the health information directly from Medicare? And then why can't we take all of that data and start to understand, well, if I have this condition, there's probably many others who have had it, and what are the best recommendations for them based on hospitals, based on providers, based on treatment? So he forged a relationship with CMS, the Centers of Medicare and Medicaid, and we're now one of the authorized technology partners with CMS. So we, on a member's behalf, we can access their health information. So we like to think of ourselves as an active health monitoring and recommendations tool. So it's very proactively pushing information to you, and oftentimes, just as importantly, adult children on any changes that have happened to the Medicare member, and information, pulling information about that diagnosis, about medications that you may need to be on, any complications or interactions of medication, and then we're Medicare, CMS, they pull ratings information from patients, and they do this as a way of getting at value-based care. And we have access to all of that as well. So we're able to actually relay that back to members and their caregivers in terms of who might be the best provider in terms of a treatment center or an actual doctor. And then again, one source to get all this information about what the diagnosis is, what you can expect, and then proactively pushing, like I said, information about prescription interactions. In this survey, that was one of the top things that adult children wanted. They wanted to know, if my parent's on a new medicine, what's the ramification of that? But we're proactively pushing that through the app.
So your organization is like the phone number that some insurance companies give you and say, hey, there's a nurse on call and she'll answer all your questions, whatever. Are you simply giving out information and making recommendations, or do you do more?
Well, it's personalized health. So it's based on you specifically, right? So,
one-on-one.
When the HIPAA Act came out in 1996, right, we all think of it as protecting your security. But the other part that no one can imagine is access to your health information, right?
You have to be able to assign it.
Yeah, and to assign a third party like us to retrieve that for you. So that's what we are. We're an agent of the Medicare member. So you're getting specific recommendations based on your diagnosis. So we're looking at all of these, what's called ICD-10 codes, all these diagnosis codes, and we're looking at, okay, from a data standpoint, who else has had that similar condition, and what are the best outcomes? Now we're evolving. We're one part a consumer app. We're another part a data analysis company, right? So we're continuing to enrich this platform as we get more and more data in. But today it's a very vibrant platform for any Medicare member. You sync your Medicare account. So at Medicare.gov, mymedicare.gov, you sync your account with it, and we're able to immediately pull in all of your your claims information. So, and again, we have a way of allowing you to enable an adult child or caregiver to sign up for your account as well.
I'm going to ask the question about whether or not this data is available for sale.
Oh no,
it's
not for sale at any price.
No, we wouldn't be approved through Medicare if we were reselling it. No.
So who pays you? Does
it could be anonymous? That's why I was asking, because that's valuable data. Yeah.
So who's paying you? Is the insurance company paying you, or is the patient paying you?
Yeah. So right now it's a free app, and our hope is that the data will, working through providers and plans, right? We will be able to access data from them as well, and that's data that obviously is valuable. What we're doing is looking for patterns in the data. It's data they already have. We're able to identify those patterns, and then most importantly, empowering the patient to action. Right. That's really what we believe in. Is what HIPAA was all about, is giving people useful information that they can act on, that they can trust.
Well, it's definitely needed, but how do you make your income? How do they make the payroll? Where does your money come from if it's a free app?
So we launched our latest app in January. That's when I came on board. We rolled it out. We have a market test coming up. I can't talk about it yet, but it basically will come from the providers and the plans who are going to benefit from empowering patients to the best courses of action, right? So we're able to identify patients based on high risk for them, and then also engage the patients in their best care pathway. Our feeling is, if you can educate people on what the best pathways are, they're much more likely to take the right courses of action. We did the survey and with caregivers, and we asked them, what's the biggest concern that you would say Medicare members have? And 50% was confusion. I'm confused. How do I pay this bill? Where do I find the best treatment? It's still 50. That was 50%.
And when you call them up, they find out that they're confused too.
That's right. And for your audience, when we ask them, what's the biggest challenge that you face? And 47.8, number one, stress and fatigue.
Oh, of course.
It's just
not surprising.
It's just so overwhelming. And again, like, I came from the outside, and it's the first thing I looked into, right? Was, obviously our products for Medicare members, but the first thing I looked into was, what about the care advocates? Because I know that's going to play a big role in this. And that's when I was really enlightened. I think it's almost like a hidden, what do they call it? A hidden crisis in our country, right? Like,
yeah, like a tsunami, like caregivers.
Yeah.
So we're going to take a quick break here. Don't go away. We'll be right back. I'm Dave Nasani. My fourth book, Secrets from the Hammock, Uncommon Wisdom for Uncommon Times, is a #1 bestseller on Amazon. As a young boy, I was told I possessed an unusual amount of wisdom for my age. As a young man, I found myself counseling friends and older family members whenever they needed answers to their problems. Then at 21, I read the Bible for the very first time and learned how King Solomon asked God for wisdom instead of riches, yet he received both. I was so impressed that I too asked God for wisdom. Soon after, I discovered when lying on my hammock, I would receive wisdom from God. This book is the result of my passion to share with the world wisdom's tremendous benefits. Join me as I reveal practical aspects of wisdom for the mind, body, and spirit. 31 lessons I learned from God that can change your life. Available in hardcover, Audible, Kindle, and paperback, wherever books are sold. I've spoken all over the country and London, and am available to speak at your event. Contact me at hammockwisdom.com. And welcome back to the Caregiver Dave Show. I'm Dave Nasani, your host, with my lovely co-host Adrian Gruberg and our guest Tom Alexander. And Tom, I wanted to ask you, streamlining pathways to the best healthcare options, how exactly is that done? And is how long do you think before your business model starts having providers pay your salary?
Yeah, good question. Well, we hope that with this market test we're doing with a partner, that will really, because we're able to show the enormous benefit we're bringing them in terms of streamlining the service for them. But right now, you were asking about how do we streamline that. So what we do, and I'll stay in the Medicare realm for this audience. So what we're doing is we're able to access this data, authorized from CMS to look at the data of what, not only what the condition of, the diagnosis of the member is, but also we're able to pull in ratings information and get at, okay, if you've been diagnosed with a certain condition, this is the best provider for that condition in your area. And we're able to allow you to look up, okay, well, what if I, within a 10-mile radius, we call it your radius of care, in a 10-mile radius, or what if I was to go 30 miles? Well, we'll alert you if there is a higher rated provider that goes outside of the 10-mile radius, right? Yeah. So that's what helps. And then again, we're going to be launching a second version of the app that we're really excited about that makes it even easier to add in care collaborators. So you'll be able to send an email. It'll be authenticated, double authenticated, but you'll actually be able to invite through email a caregiver to come in, and then they'll get access to that same information, right? So that helps in streamline it, because again, oftentimes, if you're a caregiver, you're on the front line of deciding, well, where should I take them? Who is the best provider based on their condition?
Yeah, how do you vet the providers that you're saying are the best providers?
Yeah, we're utilizing, so CMS does ratings. They do both ratings of outcomes of procedures, but also patient rated outcomes. So reviews of other people that have, so we're able to match up the conditions that those folks have had with the, with the ratings.
And this is on a national platform?
Yep. It's available. If you go to, well, you're probably going to ask that, but if you go to myradiuscare.com, you can sign up for free. The only step you need to do is sync up with, hopefully most folks have already signed up on mymedicare.gov with their, with their account. I would strongly recommend it if they can't. There's lots of useful information there. And then as an authorized partner, it automatically syncs up and we're not pulling information over, we're accessing it in their database.
So you recommend first we go to mymedicare.gov? Is that right? Is that what you said?
You don't have to. You can go to myradiuscare.com.
Is there any benefit to doing something on mymedicare.com or to go?
Yeah, it's a great tool. They give you information on what kind of plans.
I don't think I've ever done that, and I'm 68. But there's a lot of things I haven't done, and I'm 68.
Yeah. And then once you set up an account there, then you'll be able to sync. So in other words, if you start at myradiuscare.com and sign up, it'll send you over there, and then it'll ask you to set up an account there. So
is that my radius? What's the last word in there?
Care.
Care. Okay.
myradiuscare.
Care. CARE. Okay.
Yep.
.com. Right.
That's right.
Okay. Well, I'm going to do that, and I think Adrian's going to do that. So this isn't just for caregivers. This is for anybody who's on Medicare, anyone who's not on Medicare, anyone who's got medical questions, anyone who wants to find out where their medical records are. I just heard on the news the other day that trying to find someone who's trying to have access to their medical records. They have an HMO. They actually have 2 HMOs in 2 different states. And she's saying, I can't get my medical records. Everyone is saying, well, you got to talk to them, and they don't answer the phone, and they don't answer their emails, and so on. So, I have no trouble getting my medical records, but I don't have a lot of records, but I do. I've had surgeries for orthopedic stuff, but there are some people who absolutely do not have access to their medical records. How common is that?
Yeah, I think it's very common, especially if you're using different providers, right? Because, the records through an EHR are held within that provider. But what if you go outside of the provider group?
Well, they're afraid that they're going to be sued. And that's the reason this person I heard on talk radio say that they wanted the medical records because she wanted to sue them. And once people think you're going to sue them, they drag their feet and they take forever.
I give CMS a lot of credit, right? Because they do really want you to have access to your information. But it's, somebody's got to build the engine. Someone's got to make it easy for you to do that. And that's what we're trying to do. They've created this situation where you go through the rigors to become authorized, which we've done. So that's what we're trying to do, is just make it simple and easy, which we think it should be, for you to get access to your own information, your own diagnoses, right? And history. We go back 4 years. Even if you're on Medicare, you can see 4 years, every doctor you've seen, every treatment that's gone through. And then we're continuing to add to the application. We have a new one coming out in a couple
How many people are working in Radius?
Yeah, so that's a great question. We have a great group of folks that don't necessarily work at the company, but we hire like technology teams and things. We'll eventually get there where we'll probably bring that in-house. But we have a strong IT group because, again, it is a data. There's a lot of data analytics behind what we're doing, so we're not an enormous company in terms of specific Radius Care, but we bring experts in to help us ramp up, and hopefully soon, we'll be adding folks. Like I said, we're doing this market test that we think should be pretty enlightening.
I wanted to ask you, at your myradiusshare.com, is it easy to register? And once you're registered, how long does it take to get immediate access to your healthcare records?
That's the pretty cool thing. It's instantaneous, and it's my
You're
Radius
kidding.
Care. My Radius Care.
I know it's all out there on the internet, but I can't access it. I don't know how to access it. You need, oh my gosh, really?
That's the magic of it. Is because we're integrated with CMS, right? So it's an extension of that Medicare.gov account.
And the people who don't know what CMS is, explain.
Center of Medicare, Medicaid. Yeah. You go to mymedicare.gov, and that's who we sync with.
I see. And they've got access to everything immediately, right? They just won't give it to you.
No, I have medical records that include CAT scans and MRIs and discs, and I mean, how do you deal with that kind of
or
data?
The privacy? How do you deal with the privacy as well?
They've got a HIPAA policy.
Yeah.
Yep. We secure your data, and we've gone through the rigors through AWS, or I'm sorry, with Medicare of securing it. Mm-hmm. And it's on the Medicare server, and we're just accessing it on your behalf. So it's almost like you're going there yourself in a way. We're just doing it on your behalf. But also what we're doing is we're serving it up to you in a way that is easily digestible. Because so we're, in other words, if you've been diagnosed with something, we're also pulling information from, let's say, the National Institute of Health or the Library of Medicine. So we're giving you very trusted, peer-reviewed information related to that diagnosis. So the idea is, you don't really have to do anything actively, because we're doing it for you. So if you're diagnosed with a condition, we send you an alert that says, here's the information on that. If there's a medicine related to it, we give you information on that, again, pulled from this kind of health encyclopedic information. We'll be adding in, discounts on medications. And like I said, we're making it very easy to add care collaborators as well. And then as we move further and further forward, the data will get smarter and smarter, and we'll be able to make more and more suggestions for you. So, here are some suggestions you might think about based on, what you've been diagnosed with, and that's all based on population health data.
It's like a credit report, but how far back does the information go?
Yeah,
because credit drops off after 7 years.
Yeah, we go back 4 years with your health, your information.
Yeah, I wanted to know about doctors that you might have on, if not on staff. Clearly, you're recommending things like medication. Somebody's got to be advising you.
Yeah, it's the doctors that are really driving the whole process, right? We're just reporting back on their diagnosis, right? So again, it's the spirit of what Medicare wants to do, right? They want you to have information at your fingertips about diagnoses that have come through, right? So what we're doing is the doctor does a diagnosis. We get that on your behalf from Medicare, and then we send you information. So the doctors just prescribe this medicine to you. Here's some information on that medication, right? So we're not making, making medical suggestions. We're responding to the diagnosis that we're made with useful information. And so we do provide recommendations on, or information on, hey, here are the highest rated providers, right, in the health system. That's all based on, again, some of this value-based information that's being collected. Others that have seen the doctors before, how did they rate them? How well, what's the efficacy on them doing these procedures? These are all pulled into ratings that we're able to access on your behalf. So yeah, we don't proclaim to be, a doctor or health professional ourselves. Yeah. We're using, we're able to access that information on the member's behalf and report back insights into it.
And, brand new caregivers, which there's one every day, more than one, get the job and they don't know where to start. And this is a great relief to them that they can make one registration online and all of a sudden they have access to all of their loved ones' health records right there. They can see if the doctor's been doing what he's supposed to do, if the prior caregiver's been doing what they're supposed to do. And it really is transparency, isn't it? So I can see why the caregiver would love this. What is the insurance company's motive to love it so much that they're going to pay for it? What's in it for them?
That's a great question. They struggle with what I think probably what a lot of companies struggle with, which is engagement of members. And so, like a lot of industries have changed, remember in the old investment days, you'd have a broker, right? Before you could do your own investment, right? Or real estate, imagine trying to look for a house like years ago without, some of these online services, So we feel like health is the same way, that you should be, you're going to expect to be empowered with this information, right? And so we believe, and we know the health plans do want their members to be engaged 100%. It's just a matter of how effectively are they doing that? And we believe we have a really effective way of engaging people by personalizing the experience and motivating them.
I would think that they would not want to engage with their insured, because most people have a very negative opinion of their insurance company or their HMO. They have a lot of criticism, and I would think that they wouldn't want to hear people complaining all the time. So that's very interesting.
Well, if you get them to the best service and you educate them, we feel pretty confident that they'll have a better overall perception or review of their the healthcare.
Well, and it brings competition into the equation, and maybe they're going to finally realize, hey, if we want our client to stay with us, maybe we better treat them better, because now they have access to networks and find out, hey, this PPO, this HMO, whatever, is treating me a lot better than that one. I mean, my aunt was with Kaiser, and I'm not going to say anything about anybody here, but we got her out of Kaiser because, number one, it was too far away. She lives in Valencia, and you got to drive into town, into Panorama City, and it was just so inconvenient. And that alone is a reason to, change. And so it was very hard getting Kaiser, because they're so big, to send the records to the new doctor here. Months. It took months. I don't know why, but if we had you, then we could have gotten it a lot easier, right?
Yeah,
you send it to us, right? And then we can send it to our doctor. How's it work?
Well, you have access to it,
Well,
So-
that's my next question is, in terms of HIPAA, how do you know that the person, if it's a caregiver, how do you know that the person that's asking for the information has
how do you vet them?
clearance? I mean,
so
Question.
like a lot of other services that allow for multiple people on an account, there's a two-step verification, right? So we have to ensure that this is your email, and then usually you'd verify that through a mobile number, right? They're not able to. They're just seeing information, right? They're not able to manipulate, like on a, it's not like a financial situation where they could steal your money. I mean, they're not able to actually do anything other than see the information. So, but what we ensure, a two-pronged approach from an authentication standpoint. So if you invite, let's say, your son or daughter in via email, they have to then validate that it's them through a mobile device.
And they have to be invited.
You have to be invited. Yeah.
what if it's your next door neighbor that's calling, and you don't know that they're trying to access your medical records?
And they don't have permission?
Yeah.
Yeah,
How do you screen them?
They wouldn't be able to access it. They would have to, go through the authorization process. They can't just call in,
It's like you're checking in your bank account number. How does the bank keep strangers from checking on your bank balance? There's security checks. And then if you give the bank the name of a signer, you make them a signer or something like that, then they're okay. But once you're in, you're in. But it was very hard to get in to be one of those trusted persons. So power of attorney is not necessary for this?
No.
That's good, because a lot of people don't want to go through a power of attorney, and a lot of people say that they've got to. Well, I can't believe we have run out of time. I didn't get to all my questions, but it's interesting and fascinating talking to you. In the next 30 seconds, what would you like to share that we haven't discussed? Obviously, how to get a hold of you, and if you have a book or anything, and the website, all of that.
Yeah, well, we're open to discussions and partnerships. I think anybody who's providing services for the Medicare population and caregivers, so at-home service, monitoring service, telehealth services, we're very interested in talking to folks in those areas, and as well as, of course, providers and plans. But we think it takes an ecosystem to support this, right? But I would just say to your audience that I'm most excited about the value that we bring caregivers.
Yes.
That having all that information in one place. Because think about it, what if you have 4 siblings and you're doing the same thing I did? No longer. You can all come to the same app, see the same information, and then you can have your discussion based on those facts, not just getting up to speed on things. So that's my parting thought, is that I think it just really helps with care collaboration.
Mm-hmm.
Yeah, and 2 other things that we didn't mention either is the caregiver shortage. We can now network and find out who are the good caregivers out there and who are the ones that we shouldn't be contacting. And prescription drugs, the high cost of prescription drugs. Some people have connections. Do either of those 2 topics help out in what you do?
Do we help? Yeah, we have discount this will be in our the next release in August. So we make discount prescriptions available through a partnership we have. And the other one was about vetting out care. No, we wouldn't get into that, like vetting out caregivers. But it
was about a caregiver shortage. And so, so many people, I'm sure they tell Adrian too, we need a caregiver and we just can't find anybody in our area. Yeah,
we're looking for partnerships on that.
Paid or, professional or family.
Yes, we're exploring partnerships where we can make local resources available. Because, if we know that, let's say, a parent has been diagnosed with something that might need, more home care, we can, we can then alert them to resources. So that's absolutely part of what we want to do. We're early. So, you think of us like building a house here, right? We started with a foundation, which is, well, where do I find the best care in terms of hospital? And then we're going to add on all these other services as we roll.
And how long have you been doing this?
Well, I joined end of last year, and we just launched the product from a marketing standpoint around January. And then we're releasing our second app already in the next couple of months, which will have a lot more utility in it. So
we need to get the app from the App Store, right? Or from Google Play Store, yes?
Yep. Or you can go straight. Yeah, you can see it all at myradiuscare.com. You can sign up on the website there.
So they have to sign up first before they download the app, yes?
Yep. And our next version of the app, the native app, will be, I'd say, even a lot easier to navigate. We started with a web-based product. That's how a lot of the seniors wanted to use it. And now we're going to launch in August with the next version of the mobile app.
All right. Well, thank you so much for coming on the show.
You. It's great meeting you.
I can't believe how fast the time has gone, but thank you to all my listeners out there all over the world for tuning in every Wednesday on your favorite platform and making us the #1 caregiver podcast on the internet. So until next week, same time, same channel, may God richly bless you all. And don't forget, I've got a new book coming out. No, I'm sorry. My new book is already out. Secrets from the Hammock, Uncommon Wisdom for Uncommon Times, available wherever books are sold. It's a great story about wisdom and how you can have more of it. And until next time, thank you. Bye-bye.
Sometimes it feels like the sun will never rise, like the birds will never sing.